6. Person-centered disability services. Disability services support individuals to live a fulfilled life of their choosing. (66) Action. We will continue to implement the Transforming Lives programme with a focus on supporting people with disabilities to live ordinary lives in ordinary places. Responsible body, Health Service Executive, National Disability Authority, Disability Service Providers. Time frame, ongoing. 67. Action. We will continue to support and monitor a new evidence-based framework for person-centered planning across residential and day services. Responsible body, Health Service Executive, Disability Service Providers. Time frame, ongoing. 68. Action. We will continue to provide guidance on person-centered planning, informed by research products for Transforming Lives WG2. Responsible body, Health Service Executive, National Disability Authority, Disability Service Providers. Time frame, ongoing. Achieve maximum independence. 69. Action. We will strengthen the focus on culture change from the care to the support model. Responsible body, Health Service Executive, Disability Service Providers. Time frame, ongoing. 70. Action. We will roll out the Informing Families guidance. Responsible body, Health Service Executive, maternity units, pediatricians, multidisciplinary teams, general practitioners, disability service providers. Time frame, ongoing. 71. Action. We will deliver a model of disability services that provides support for empowering people to make decisions in their own lives. Responsible body, National Disability Authority, Health Service Executive, Disability Service Providers. Time frame, ongoing. Participate in the everyday life and activities of their communities. (72) Action. We will roll out an implementation program for the New Directions Personal Support Services for adults with disabilities. Responsible body, Health Service Executive, Disability Service Providers. Time frame, ongoing. 73. Action. We will evaluate outcomes of local area coordination pilots. Responsible body, POBL, Health Service Executive, Department of Health, Disability Service Providers. Time frame, ongoing. 74. Action. We will develop actions at community level to build and sustain for disability competent and welcoming communities. Responsible body, local authorities. Time frame, ongoing. 75. Action. We will ensure that new buildings and facilities for arts, sport or leisure are based on universal design principles. Responsible body, Department of Transport, Tourism and Sport, Department of Arts, Heritage and the Gaeltacht, Sport Ireland, local authorities. Time frame, ongoing. 76. Action. We will foster disability awareness and competence in voluntary, sporting, cultural and other organisations. We will ensure that disability inclusion is fully integrated into funding programmes, monitored and linked to further funding. Responsible body, Department of Transport, Tourism and Sport, Department of Arts, Heritage and the Gaeltacht, Sport Ireland. Time frame, ongoing. Be an active citizen. 77. Action. We will fully support persons with disability in the achievement of active citizenship and engagement. Responsible body, all departments, disability service providers. Time frame, ongoing. Children and adults with disabilities have timely access to assessment and early intervention and the therapy, rehabilitation or mental health services they require. "78. Action. We will complete the programme to provide area-based multidisciplinary therapy teams for early intervention and school-age services in all areas. Responsible body, Health Service Executive, Disability Service Providers. Time frame, 4th quarter 2017. 79. Action. We will implement the Outcomes for Children and Their Families framework, which applies to all children and families accessing children's disability services, including children with autism. Responsible body, Health Service Executive, Department of Health. Time frame. Demonstration sites for implementation of the Outcomes Framework will be completed by 30th of September 2017. 80. Action. When implemented, we will evaluate the effectiveness of the progressing disability services. for Children and Young People programme in meeting the needs of children with disabilities. Responsible body, Health Service Executive, Department of Health. Timeframe, 4th quarter 2019. 81. Action. We will agree protocols between disability services and mental health services to ensure appropriate access for people with disabilities and mental health issues to mental health services. Responsible body, Health Service Executive, Department of Health. Timeframe, ongoing. 82. Action. We will develop an implementation framework for the neuro-rehabilitation strategy, making links to national clinical programs for medical rehabilitation, and make a major capital investment in the National Rehabilitation Hospital. Responsible body, Health Service Executive, Department of Health. Timeframe, Phase 1 Community Services of Implementation Plan to be finalised by 3rd quarter 2017. 83. Action. We will ensure full implementation of a vision for change. Responsible body, Health Service Executive, Department of Health. Timeframe, ongoing. 84. Action. We will develop and implement effective national joint working protocols between child and adolescent mental health services, CAMHS, disability services and education to ensure children and young people with disabilities can access CAMHS. Responsible body, Health Service Executive, Department of Health, TUSLA. Timeframe, 4th quarter 2017. 85. Action. We will consider, in the context of the forthcoming review of mental health legislation, how best to support people within the system, including the provision of an advocacy service. Responsible body, Health Service Executive, Department of Health. Timeframe, will be considered as part of the new bill referred to under Action 11. Disability services are delivered to high quality standards and in line with international best practice. '86. Action. We will ensure continued health information and quality authority registration, regulation and inspection of disability services against standards and regulations, and provide for the next round of inspections with particular focus on thematic inspections against key quality of life outcomes. Responsible body, Health Information and Quality Authority, HIQA. Timeframe, ongoing. 87. Action. We will undertake a review of the regulations in a consultative process which will be informed by the National Disability Authority review of the first year of inspection process for disability residential services. Responsible body, Department of Health. Time frame, second quarter 2018. 88. Action. We will continue the work of the Quality Improvement Team in Health Service Executive Disability Services and extend it to key non-health service executive providers. We will also complete a review of quality frameworks and implement the findings. Responsible body, Health Service Executive. Time frame, fourth quarter 2018. People with disabilities are involved in the planning, design and evaluation of disability services. '89. Action. The National Disability Stakeholders Group, which includes a number of individuals appointed in their own personal capacity to bring their lived experience to the table, will continue to have a central role in monitoring the implementation of the new National Disability Inclusion Strategy. Responsible body, Department of Justice and Equality, National Disability Authority. Time frame, ongoing. 90. Action. We will progress proposals of the reference group on mental health service users' involvement. Responsible body, Health Service Executive, Mental Health Services. Time frame, ongoing. Individualized funding to be introduced and the option of a personal budget. '91. Action. The Personalised Budgeting Task Force will report to the Government by the fourth quarter 2017 and its recommendations will be considered by Government in line with the commitment in the Programme for Partnership Government. Responsible body, Personalised Budgeting Task Force, PFG commitment. Relevant departments and agencies. Time frame, fourth quarter 2017. 92. Action. We will adopt and implement a single needs assessment tool for disability services. Responsible body, Department of Health, Health Service Executive. Time frame, second quarter 2017.